My goal today really, or my job, is to kind of set the stage for you for really an impressive array of speakers that will come after me to discuss BVD virus, which has been around for a long time. In fact, when I was a graduate student at Ohio State, I worked with Dr. Kenny Brock, who's now at Auburn University and kind of one of the pioneers of doing research with BVD. I actually went to a conference that was held at Cornell University, which was the 50th anniversary of the discovery of BVD virus. So, and that was back in 1992, 93, somewhere in that area. So that tells you how long this virus has been around and how the importance of the virus. In fact, we're still trying to figure out how best to deal with this. So my goal is basically just to set the stage and then allow the speakers that follow me to provide you probably much more important information than what I'm going to provide for you. I think, and I was thinking about after being asked to speak at this symposium, I was thinking about what are kind of some of the overall objectives that I think we want to continue to talk about. Obviously, we want to continue to educate the industry about BVD virus. I think as an educator, as a person that's worked in extension at MSU, that's something we continue to do. We want to educate producers, veterinarians, the general public about this virus or any infectious disease for that matter, the importance of it to the industry and how we can go about controlling this important virus. We want to continue industry dialogue about control of BVD virus. So this is something that we've been doing for quite some time, engaging NCBA, engaging other industry partners on what we can do to further control this virus. Obviously, we want to continue to develop and identify cost-effective control programs. Ultimately, and as we heard yesterday in the kind of closing biosecurity session, we can have the best ideas, we can have the best plans, we can have the best bells and whistles and tools, but if they're not cost-effective, they're probably not going to be implemented. So we got to continue to look for those cost-effective tools. Ultimately, our goal is to significantly reduce, if not eliminate, BVD and BVD-related losses. That's our ultimate goal. So my specific goal today is really to just kind of set the stage and kind of cover a little bit about the background of BVD virus. And what I'm going to present may be somewhat basic for many people here, but not knowing exactly what the audience is going to be, whether it's producers or veterinarians or industry folks, I want to make sure that everybody's kind of on the same playing field as we go forward and talk about this virus. So just really some basics to start with, reminding everybody that this is a viral infection of cattle. It's a virus, BVD virus, that actually can affect multiple species, and not only cattle, so lots of species we know can be infected, including sheep and pigs, camelids, cervidae species. It's an RNA virus. It's a member of the pestivirus family, and one of the key reasons that it's important to know that it's an RNA virus is because RNA viruses, especially members of the pestivirus family, can change and mutate rapidly. Okay, so the RNA can change, and we can get different different presentations or different antigenic presentations of this virus. So this rapid mutation, this rapid change of the virus can lead to diverse clinical presentations, not just diarrhea. One of the common comments that I get when I talk to producers in Michigan specifically, and we talk about bovine viral diarrhea virus, they say, "Doc, but we don't see diarrhea in our cattle." When I talk about BVD virus causing reproductive losses or respiratory disease, they say, "We don't see diarrhea in our cattle, so it must not be BVD virus." So we have to understand that this virus causes a lot more things than just diarrhea. And obviously, the other thing that the mutating ability of this virus can do is lead to diverse antigenic makeup of this virus. This creates challenges when it comes to vaccines. Creates challenges when it comes to diagnostics as well. So this is part of the puzzle when it comes to actually controlling this virus. I just want to point out, as far as this diversity, this is actually the kind of the variety of different pestiviruses, and this is actually a figure from a presentation by from a publication, I should say, by Bowerman. Dr. Ridpath gave me permission to use this, so thank you, Dr. Ridpath. But essentially, we have BVD viruses. We actually have two different genotypes, types 1s and types 2s. But as we mentioned, we have viruses that affect sheep, the border disease virus, as well as classical swine fever in pigs. Interestingly, if you're not aware of it, there's a third kind of new pestivirus out there that we've recently identified and are currently learning more about them. This is the Hobie-like viruses. So if you're not familiar with the Hobie-like viruses, I think this is a virus that everybody should learn about and pay attention to. This has been called BVD type 3. So something on the horizon that you might want to pay attention to. And I'd point to some publications by Dr. Ridpath and her group at Ames that kind of talk about this kind of emerging pestivirus that may be a problem in our cattle industry. So let's talk a little bit about the kind of the clinical or kind of the what BVD viruses does. And I use this slide a lot because it kind of encapsulates in one slide kind of all the different things that BVD virus does, specifically with respects to cattle. And I'm just going to kind of walk through this very quickly so that we can see this. So if we first talk about kind of what is termed actually a variety of different things, either acute or transient or primary infections. These are the infections that would be similar to if you or I got infected with the flu virus, okay? If we got infected with flu virus, the virus would replicate, we're immunocompetent, hopefully our immune system would kick in, but before the immune system kicks in and gets rid of that virus, we get sick, okay? We get sick, we feel bad, hopefully if we're lucky we get over it and we don't die from the virus. Well, this is basically what these acute infections or transient infections are in cattle. And the outcomes from these infections can be multiple, the clinical outcomes, and we've identified lots of different outcomes that occur from these acute infections. And so I've listed some of those up there. This isn't all-encompassing. We can just have something as simple as subacute infections or subclinical infections where we actually don't identify any clinical signs that we can see grossly. Certainly we can have acute diarrhea. Probably one of the hallmarks of BVD virus is immunosuppression. So this virus is known to cause suppression of the immune system, which then subsequently can lead to a variety of different clinical outcomes. And this is probably the most important issue with respects to the feedlot industry. The virus is immunosuppressive in the feedlots, allows for secondary bacterial infections to grab hold in the lungs, leading to respiratory disease. Bovine viral genotype 2, when it swept through the United States probably 20 years ago, was the virus that was found to cause this clinical presentation of thrombocytopenia, so a bleeding disorder. So again, a variety of different clinical presentations that can occur from these acute or transient or what also is called primary infections. One of the other hallmarks of these infections is that if we have cows that are pregnant or that are reproducing, these primary infections can lead to fetal infections. And we'll get to that here in a second. So again, just kind of a graphic. So we have a immunocompetent cow that's never been exposed to BVD virus. They become exposed to the virus. The virus starts replicating the animal. The replicating virus then leads to some type of clinical disease. But eventually, those animals will start shedding the virus and could serve as a source of transmission to other naive animals. But eventually, hopefully, the immune system kicks in, eliminates the virus, and the animal continues to live. So that's our transient or acute, or also known as primary infections. So let's talk real quick about these fetal infections. Again, one of the hallmarks of BVD virus is that the virus can cause infection of the reproductive tract and can lead to a variety of different reproductive outcomes. And again, I've listed some of the reproductive outcomes that have been associated with BVD virus. We can get abortions at any stage within gestation, congenital infections, congenital defects. These occur with infections later in gestations. Early infections can lead to early embryonic deaths. So a variety of different outcomes that can occur if we have infections in naive animals or even sometimes in immune animals when they become infected with this BVD virus. But probably the most important thing that occurs with fetal infections is that we can get these infections during a narrow window of time of the fetus that leads to the formation of what are called persistently infected animals. And as we'll talk about here in a second, it's really these persistently infected fetuses or calves when they're born that are the major source of transmission of this virus, both within farms as well as between farms in our cattle population. So these persistently infected animals, again, we'll talk a little bit more about these here in a second. These animals typically, if they are born and if they survive, they're typically immunosuppressed. So many of these animals die at a young age because of secondary infections. They're usually poor performers. There are some persistently infected animals that can be completely normal. Okay, we've had PI animals at Michigan State University for 5, 6, 7, even up to 8 years that you would never know were persistently infected with the virus unless you happen to take samples from them and actually look for the virus in those animals. So that's probably the rare event, but in most cases these PIs are poor performers. They're usually kind of sickly animals, and often they die at a young age. One of the outcomes of PIs is that they can get this super infection or this type of infection which is specific to persistently infected animals, and that's a clinical syndrome called mucosal disease. And we're not going to spend much time on mucosal disease. Invariably, it's a fatal disease and leads to these animals dying, which is, in my mind, probably a good thing. It's okay that they die. So we're not going to spend much time on those. What I want to spend more time on is the role of these PIs in actually spreading the virus both within a farm as well as between farms. So these PIs, again, these are probably the most important thing that we have to worry about when it comes to controlling BVD virus on farms. This occurs with a fetal infection, so a viral infection of the cow, which is then transmitted to that developing fetus somewhere prior to day 125 gestation. So usually in a window of day 60 to day 125 of gestation. Certainly there can be some variation around that, but basically within that window of time, if we have a fetal infection during that time, we can lead to, or we can get the development of these persistent infections. This can occur through acute infections, or if we happen to have some of those normal, persistently infected animals that survive to reproductive age, they invariably will produce persistently infected calves as well. So you can actually get families of PIs. That's a rare event, again. That's a rare event, but we can get families of PIs. So when this virus infects this fetus, the virus is actually recognized as a self-antigen. So that developing fetus thinks that virus, which is now circulating within that developing fetus, is actually part of itself. So it becomes what is called a self-antigen. The calf then becomes immunotolerant to the virus. So basically, it does not develop an immune response to that replicating virus, and this invariably leads to the persistent infection with the virus. So again, just some graphics. We have a naive cow here. And she becomes infected with BVD virus. The virus starts replicating within that cow. Some of the virus is being shed, but some of the virus invariably will cross that placenta. Again, this is during that narrow window of time, somewhere between day 60 and day 125 of gestation. The cow invariably develops an immune response which clears the virus out of the cow, but it does not clear the virus out of that developing fetus, okay? Because basically the fetus within that uterus is actually in a protected space. So the virus is actually allowed to replicate within that developing fetus, whereas it's cleared out of the cow. That calf is eventually born, and it is then considered persistently infected with virus. So in this case, this is a PI calf that was born, in this case, to a non-PI dam. And this is probably the most common thing that we see when it comes to development of persistently infected calves. It's calves being born to cows that are not persistently infected with the virus, but that cow had underwent a transient infection during that window of time between day 60 day 125 of gestation. As I mentioned, we can get PIs that survive to reproductive age and can develop persistent infection. So here's a persistently infected cow. She made it to reproductive age. She got pregnant. Because she's persistently infected, the virus easily transmits across the uterus, and when that calf is born, the calf is persistently infected, the cow is persistently infected as well. They're both PIs. We can get families of PIs, but again, this is a rare event. This doesn't happen very often. Here happens to be a case of a cow in Michigan that was persistently infected and gave birth to a PI calf. So some characteristics of these PIs, again, they're lifetime carriers and shedders of the virus. So as long as those animals are alive, the virus is going to be replicating within those animals, and they're going to be shedding that virus and serving as a source, as a reservoir of infection for animals that they come in contact with. Virus is usually present in high titers in blood, and it's excreted in all excretions and secretions, nasal secretions, saliva, feces and urine, semen, and milk as well. So basically any excretion or secretion coming from those animals can serve as a source of infection for naive animals. This also can be found in a variety of tissues, and this is actually the basis of some of our diagnostic tests, some of the skin tests that we use for detecting the virus or detecting persistently infected animals. Again, as I mentioned in an earlier slide, these PIs can be normal, completely normal looking, but more typically they're poor performers and their survival in the herd is typically low. They're often die at an early age, or they may be culled at an early age because of their poor performance. So this is a calf at a feedlot that we worked with that was having, actually it was on a different project, but we did some work with them on BVD, and this is a PI calf that was in a feedlot who was affectionately known as Nubby, because he was small within the group, and it turns out that he was a PI calf. And ultimately, whether we're talking about feedlots, or we're talking about cow-calf operations, or whether we're talking about dairy operations, these are the animals that we want to, number one, prevent from ever existing, or if they do exist, we want to identify them and remove them from the herd, because they are the source of viral infection to their cohorts. Okay, so just a little bit about why it's important to control BVD, and I think this will come out in a variety of different ways today. Obviously, and I'm going to show you just real quickly some data on the fact that BVD can impact productivity, and certainly in an industry, in the cattle industry, where productivity is important when it comes to economic return, anything that affects productivity should be important to our industry. Increased economic return, again, in an industry where if we're trying to make a living, if we're trying to put food on the table for our family, if we're trying to pay college educations, we're hopefully trying to make money and take care of those things. Decreased health risk, as Dr. Grolushin mentioned earlier, I think in today's world where animal welfare is becoming more and more important, especially to our consumers and the purchase of our products, I think this is an important animal welfare issue. There is some industry momentum to control and potentially even eradicate BVD, so this is another reason to continue this dialogue. And then I'll just mention that there certainly is international movement to control and eradicate BVD. In fact, many countries, as I'll show you here in a second, have made significant strides to either eradicating BVD or, in some cases, actually getting it out of their country. So I just want to share, and again, we have another talk coming later that will actually talk about the economic importance of BVD, so I don't want to spend a lot of time on this, but I do just want to kind of point out a couple things. Dr. Bob Larson, who's, as I hear, is on his way. Apparently, he's going to be just-in-time arrival for his talk later this morning. Again, this is in the cow-calf sector. Did a study where they looked at 10-year profitability model, and they showed that in herds that have PIs in them, there's a almost a $15 to $25 reduction, decrease in return of fixed costs per beef cow exposed to BVD PI animals. Okay, so important work by Dr. Larson that actually demonstrates some of the economic impacts of BVD, in this case in cow-calf operation. Bill Hessman did some work looking at economic impacts in feedlots in Kansas, and this is where they did a feedlot study in high-risk cattle that were exposed to PIs, and in their work they showed, using economic modeling, that PI exposure could lead to somewhere between $42 and $93 loss per exposed animal. So those are pretty significant numbers when you start adding it up over lots of feedlot cattle. If we look at productivity, again, just some very brief numbers that kind of look at productivity. Tom Whittam from Ohio State several years ago, almost 15 years ago now, looked at productivity in cow-calf operations, beef cow-calf operations around the United States, and he demonstrated that in herds that have PIs in them, pregnancy rates decreased by 5%. And this can become pretty economically significant, especially with the price of calves, or at least with the price of calves they were about a year ago, although they've come down now. It still can be a big impact if you're losing 5% of your pregnancies. We did some work at MSU looking at production or performance, or in this case, morbidity and mortality in feedlot calves exposed to PIs or not exposed to PIs. So this is under experimental or under controlled BVD exposure. And we demonstrated that, again, in a very controlled setting, that exposure to PIs, and these are high-risk calves being exposed to PIs, that morbidity rates almost doubled in calves exposed to PIs as compared to calves not exposed to persistently infected animals. And so if you add up the costs associated with morbidity or sickness in feedlot animals, whether it's treatment costs, whether it's decreased performance, so forth and so on, that can add up over time. So a couple of important points to point out when it comes to some of the studies that have looked at BVD impact. Not all studies have actually showed impact of BVD on performance. And I think this is because there's lots of variability in the virus. We know that there are certain there are some viruses that tend to be more pathologic than other viruses. There's variability in the types of cattle. There's variability in the amount of immunity that cattle may have to certain viruses. There's variability in management. Certainly management is an important factor with any disease in the potential impact that virus or that pathogen has. And so I think this just demonstrates that we still have lots to learn about this virus and more things that we can do to try to understand how best to impact the effect of this virus on cattle. I mentioned earlier that there's industry momentum to control BVD virus, and this has actually been going on now for about 15 years. Actually, this started with the Academy of Veterinary Consultants back in 2001 when they actually put out a statement where they said the beef and dairy industries need to adopt measures to control and target eventual eradication of BVD from North America. So actually, the Academy of Veterinary Consultants were kind of the leaders in starting to try to get momentum and work towards maybe eventual eradication of this virus. ABP has endorsed this, and the National Cattlemen has endorsed this as well. So this was kind of the initial momentum to get something done with this virus. And over the past 15 years, lots of industry organizations or industry events have actually adopted rules or measures to try to highlight the importance of trying to control this virus. I just point out we have a bull performance evaluation in the state of Michigan that's supported by our Michigan Cattlemen's Association and Michigan State University, and we require that all cattle that come to this bull test be tested to be free of persistent infection with BVD virus, and I know other bull tests around the country require that as well. Something very similar, and this actually started in 2008 at the National Western Stock Show. They required that animals that are going to be sold show proof of a negative test for persistent infection with BVD, and this continues today at the National Western Stock Show. So again, just some evidence that the industry is getting behind this and actually understands the importance of BVD virus and would like to continue working towards the control of this virus. And again, as I mentioned earlier, many countries around the world have efforts to eradicate the virus, most of them in Europe, and so the countries here with yellow stars have either an eradication program ongoing or they've actually eradicated the virus from their country. So again, many European countries are much farther along in controlling this virus. Okay, I will mention that we actually worked on kind of a small-scale regional BVD eradication project in the state of Michigan. If you're not familiar with Michigan, the Upper Peninsula is kind of this island of land that kind of projects into Lake Superior and Lake Michigan up in the very northern part of Michigan. It's kind of interesting that from East Lansing, or Lansing, which is where Michigan State is, to drive to the western part of the UP takes longer than to drive to Atlanta, Georgia. So that's how far away that part of Michigan is. But we actually started and conducted a demonstration project in the UP to try to control and eradicate BVD. We didn't completely, we weren't successful, but we certainly did demonstrate how we might go about, at least at a regional level, trying to control and eradicate the virus. And it really started with education, so significant education of the industry in the Upper Peninsula. And when I talk about the industry, I'm talking about I'm talking about producers, I'm talking about veterinarians, I'm talking about everybody involved with the cattle industry in the Upper Peninsula. So it's cattle buyers, it's cattle jockeys, it's basically anybody that is involved with the cattle industry. We tried to educate. Basically, it was industry engagement. So it was engagement of the industry in the Upper Peninsula, something very similar to what we're doing here. And then our control program basically was very much like what we're going to talk about today, which was finding those PIs and getting rid of those. It was biosecurity and vaccination, at least at the outset. But really, the key to it was education and industry engagement. So, just to kind of change gears a little bit and just talk a little bit about kind of the important aspects from my perspective when it comes to controlling BVD virus. What do we need to be thinking about? What do we need to be implementing or looking at when it comes to controlling BVD? So really, in my mind, it comes down to two things. First of all, it's understanding the goals and objectives of a BVD control program, and what I'm really talking about now is really at individual farm level. I'm not talking about at a national level, but the first thing is to understand the goals and objectives of what a control program would be like on an individual animal operation. It's understanding risk tolerance. Okay, so how much risk are you willing to take on when it comes to potentially preventing BVD from entering your farm or controlling it should it enter your farm? And then really the crux of BVD prevention and control are three things. It's a three-legged stool that we talk a lot when it comes to BVD, and that's biosecurity, getting rid of those PIs, and then improving herd immunity through vaccination. Those are really the three legs of a solid BVD control program. And I will argue that without all three of those legs, controlling BVD becomes very, very difficult. So you cannot control BVD, prevent BVD just with vaccination. You cannot control or prevent BVD just with biosecurity. You cannot control or prevent BVD just with identifying PIs. Okay? Really, you need all three of these components to really have a successful BVD control program at an individual herd level. So let's just real quick talk about understanding the goals and objectives and risk tolerance. Really, again, we're talking again at an individual herd level. The goals and objectives of a BVD control program will help to direct what the ultimate plan will look like on that individual farms. So depending on what an individual producer is doing or wants to do will help direct what kind of plan or what the plan might look like on that operation. So as an example for diagnostic testing, if we're selling replacement heifers or genetics, the testing program that we might use in a herd like that may be very much different than if we have a BVD outbreak that's going on in a herd and we're trying to clean up the aftermath of that BVD infection. So diagnostic testing will depend on the objective of what's going on in that operation. On a biosecurity plan may be much, much different in a commercial cow-calf herd versus a purebred seed stock operations trying to sell high-end genetics that are healthy and not spreading diseases to the people that are buying those seed stocks. All right. So understanding the goals and objectives are very, very important in developing that ultimate plan for those individual farms. I think we also have to understand the risk tolerance of individual farms. Because depending on a person's risk tolerance will help us understand what they're willing to accept and not accept when it comes to control programs. And again, this is for any disease control program. It's not just specific to BVD. So as an example, with respect to biosecurity, if a producer has zero risk tolerance for BVD virus, probably they need to have, with respect to a biosecurity plan, a closed herd management system with internal growth only. So bringing in cattle from the outside when you have zero risk tolerance for BVD virus, or for that matter any infectious disease, is probably not acceptable. On the other hand, if you have high risk tolerance, then you're probably willing to accept the fact that if you buy purchase replacements from unknown backgrounds, you're probably going to bring BVD virus into your operation at some point, or some other infectious disease at that matter. So understanding risk tolerance is really important to developing a BVD control program. So with respect to this last one, I'll share an example. A large dairy farm in Michigan that we've worked with since I've been at Michigan State for 15 years, about a 6,000 cow producer. When I first started at Michigan State, they had a significant BVD outbreak. led to lots of abortions, lots of PIs being born, cows dying. But this was a producer that his model for growing his herd was buying calves or buying springing heifers from anywhere that he could find them, okay? Anywhere that he could find them, okay? And that's the model that he wanted to continue to use. So that was a high-risk situation for not only bringing BVD virus in, but also potentially other pathogens as well. And he wasn't really willing to change the way he was going to buy cattle, but what he was willing to do was to test all those incoming springing heifers for BVD virus and their fetuses when they were born as calves to try to control that BVD virus. And he was willing to do that. So he didn't change how he was going to procure cattle, but he did change how he actually was going to handle those cattle once they arrived at the farm to control BVD. And for the past 15 years, although he continues to have PIs show up on the farm, he buys cows from or heifers from anywhere, there's always PIs coming in the operation, but we identify those PIs and get them out of the herd and minimize their impact to the herd going forward. Unfortunately, now he's dealing with a salmonella outbreak with a multi-drug resistant salmonella, which is wreaking havoc. So, you know, it's always playing with fire when you're purchasing cattle like that from unknown sources. So let's talk real quick about the BVD control toolbox, and you're going to hear a lot about this from some of our other speakers as we move forward. Again, this toolbox in my mind consists of biosecurity. It consists of identifying those persistently infected animals, which really are the reservoir, the source of infection, and then it's improving herd immunity through vaccination. So again, source of BVD exposure, the major source is going to be cattle that are shedding the virus, okay, and these are either going to be those PIs, and that will be the major source, or it could be in some cases the transient infections as well. So in my mind, those are the major source of infection. So when it comes to biosecurity, how do we control those animals potentially being a source of infection coming into an operation, or if they're already on an operation, how do we find them and get them out of the operation? So replacements, bulls, embryo recipients, exhibitions, fence line contact, shared pastures, go on and on and on. These are going to be the major source of infection that we need to control from a biosecurity point of view. Other things that could be sources, but in my mind are less important. I want to focus my energies on these PIs and potentially these transient infections, but other things that we have to keep in mind, and certainly people talk about, other species being a source of infection, so sheep and goats, camelid. I know cervidae get talked a lot about as a potential source of infection, but you know what? I'm less concerned about those sources of infection if we're not focusing on the cattle as the major source. And then fomites is a potential source of infection. You know, people taking virus from farm to farm, equipment, vehicles. Yes, that probably can happen, but again, I think when it comes from a biosecurity standpoint, we need to focus on the animals as a source of infection first and foremost. So, PI heifer purchased as a replacement. Okay, PI heifer purchased as a replacement. Brought a virus in. This isn't the farm that I was talking about earlier, but this is a different farm where they bought replacements, and one of the heifers was a PI and brought virus into the operation. This is an embryo recipient with a $1,500 embryo in her, okay, persistently infected with virus. The producer brought the embryo recipient with the $1,500 embryo into his operation and precipitated a BVD outbreak in his cow-calf operation, okay? So we need to pay attention to these sources of virus coming into our operations. Identify and eliminate PIs. Ultimately, these are the animals that we need to find and get rid of. Okay, these are the animals that we need to find and get rid of. They are the most wanted. They are the dangerous criminals in my mind. This is BJ cow. BJ was one of the, actually was the first, the virus from this cow was the first virus that was ever sequenced back in the early 1990s by Kenny Brock at Ohio State University. She lived to be actually a ripe age of about 12 years of age. She was perfectly normal, and if she was out in the general population of cattle, she would have been a source of virus for as long as she was alive, spreading to her cohorts or to other animals that she became exposed to. And the cool thing is that we have lots of diagnostic assays to actually detect these PIs now. We have kind of the old guard like virus isolation and IPMA, which isn't used very much, but we have lots of new tests, whether it's ELISAs or PCR, or skin tests with immunohistochemistry that we can use to identify these PIs and get them out of herds. And again, you'll hear more about some of these diagnostic tests later in the day. The last thing is to improve immunity through immunization. In case you didn't know, there's lots of options out there when it comes to vaccination for BVD. We have over 150 BVD vaccine combinations available, not 150 unique BVD vaccines, but certainly BVD vaccines in different combinations that allow producers or veterinarians to customize vaccine programs for individual producers. So they're really adaptable to different needs. We have modified live vaccines and we have killed vaccines. So we have, and they certainly both have their application when it comes to vaccine programs. We have vaccines containing multiple viruses of BVD, so both genotypes 1 and genotypes 2, which you'll see here in a second is advantageous. And we have vaccines that can be used in various management, at various management times or in various management programs. So pre-breeding, during pregnancy, suckling calves, so forth and so on. So the point here is we have lots of options when it comes to vaccination to improve herd immunity and hopefully reduce the risk of BVD causing a problem in herds. One thing I want to talk about, and this is actually some work from the good folks at Auburn who have done a lot of work with BVD. So Dr. Givens, who will be talking here in a second, and this was actually by B.J. Newcomer, but this was actually a meta-analysis where they looked at all the studies. They looked at all the studies that looked at that have looked at BVD vaccines and whether they're actually protective against fetal infections. And if you think about this, really, when it comes to BVD vaccines, if we want to control BVD, we need to protect that fetus against infection so that we reduce the risk of those PIs being born. And so there's actually been lots and lots of studies looking at how effective vaccines are against protecting that fetus. We've done some at Michigan State. Folks at Auburn have done it. Lots of folks here in this room have been associated with some of those vaccine studies. The folks at Auburn actually did a meta-analysis, so they actually looked at all these studies and to try to say with some degree of certainty whether BVD vaccines are actually do a good job in protecting these fetuses. So this is kind of a modification of some of the information they presented in this paper, and basically just to walk you through this, if the closer you get to 0, the closer you are to completely eliminating risk or at least reducing the risk of infection after vaccination. If this number is 1, then the risk of getting infection is the same if you're vaccinated versus not vaccinated. And if the risk is greater than 1, that means that vaccines actually increase the risk of fetal infection. So the vaccines aren't protective at all. In fact, they make things worse. So I'll just walk you through this real quick. And overall, basically what the folks at Auburn found out is that, yes, vaccines do reduce the risk of fetal infection. I think everybody in this room would agree that vaccines do reduce the risk of fetal infection. Okay, our studies at Michigan State have shown that, folks, and every study has demonstrated that we do reduce risk of fetal infection. So that's a great thing. But there were some interesting differences. As you can see here, modified live vaccines had a decreased risk of or decrease the risk of fetal infection when compared to inactivated vaccines. So at least the data here would suggest that modified live vaccines might be a little bit more effective at reducing risk, but killed vaccines do reduce risk as well. So they do reduce risk. Interestingly, heterologous challenges were there was less protection. There was less protections if we used a virus in our challenge models that were different than the vaccine virus, okay? And this goes back to the fact that viruses that are different than what the vaccine is have a higher chance of actually getting past that immune response and causing a fetal infection, okay? So this is sometimes why we have vaccines that aren't as effective as we would like them to be, because if we have a virus that's not closely related to the vaccine virus, then we have a higher risk of actually having a fetal infection occurring. Polyvalent vaccines, so vaccines that have more than one strain in them, are more effective at preventing fetal infections than vaccines that are monovalent. And the vast majority of our vaccines that we now have on the market are polyvalent. They have multiple virus antigens in them, so that's a good thing with respect to current vaccines. Bottom line, when it comes to vaccines in my mind are an effective tool. I think they're a very effective tool towards preventing BVD infection and specifically towards preventing fetal infections, but they're not a silver bullet. And this is one of the things that we continue to work on in the state of Michigan with producers and in some cases even with veterinarians in convincing them that if we're really serious about controlling BVD, we can't just rely on vaccines. They're a great tool, but they have to be combined with the other strategies, the finding PIs, the biosecurity to really have an effective BVD control program. So that's our BVD control toolbox, and again, you're going to hear much more about these tools as we progress through the day. In summary, again, BVD is an important virus of cattle worldwide. It's interesting. I used to have a project in India. We take students over there, and we would, when we were there for basically 6 weeks, we'd do a variety of different kind of projects with faculty from one of the veterinary schools there. And one year we took over the BVD, IDEX BVD SNAP test over there, and we just started testing cattle for BVD virus. And it was interesting because the folks in India said, oh, we don't have BVD in India. Well, the reason they don't have BVD in India is because they've never looked. They've never looked, and when I asked, have you ever looked? They said, no, but we never see the virus. Well, we found BVD virus in India and in some of the farms that we looked at. So it's a worldwide problem, just some people don't recognize it. Obviously, losses in all sectors of the cattle industry. So we're focused mainly today on the beef industry, but this is a problem in all sectors, whether we're talking dairy or veal, stock or backgrounders, feedlots, a problem everywhere. The important thing is, I believe, that we have effective tools to control this virus. We know what it takes from a biosecurity standpoint to help control this virus. We know we have good diagnostic tests. We have good vaccinations. The pharmaceutical companies have done a good job in developing good vaccines that are an effective tool in controlling this virus. So we have the tools to control this virus. I will mention, since we're kind of focused on beef, about 6 years ago now, we put together kind of a integrated BVD control plans for beef operations, which is available out there. It's a kind of a nice peer-reviewed kind of summary of how we can go about controlling or putting together a plan for individual beef operations. And many of the folks that were part of this publication are in the room today. But I would encourage anybody, if they're kind of looking for kind of a one go-to kind of piece of information that talks about BVD control for beef operations, this might be a good source of information for you. So that brings me to the end of my talk. But Dale, since I got 10 minutes, I want to just end with one thing, okay? So I mentioned the Upper Peninsula BVD control program. This was a great experience. This was a project that we did in conjunction with Pfizer before they became Zoetis. It was a great team project that involved, a pharmaceutical company, involved an academic institute, Michigan State University, involved our Department of Agriculture in the state of Michigan, involved the United States Department of Agriculture, their regional folks that were up in the Upper Peninsula. So it was really a great team project. I'll point out that as part of our educational programs, and if you can't read that, we were part of the live entertainment most of the time up in the Upper Peninsula as we circled around the Upper Peninsula. But live entertainment was basically extension people up there giving talks on BVD, so it's pretty exciting. But one of the things that we learned, as we visited with people across the Upper Peninsula is really the ways that you can tell that you have BVD virus. And this led to us determining our top 10 ways that you really know that you have BVD virus. So this was actually developed in the Upper Peninsula in visiting with producers that had BVD virus. So I want to share with you our top 10 ways that you actually know that you have BVD. This circumnavigates, or this is above anything else that you're going to learn today, because this is probably the most important thing you're going to take away from today. So the top 10 reasons that you know that you have BVD virus. Number one is when your carcass compost pile doubles as a sled riding hill for your kids. All right? By the way, most of these have somewhere along the line actually traced back to something that was really true, to be honest with you. So although it's maybe a little humorous, there's some seriousness in most of these things. When every animal walking around with a strange V-looking V-shape and a notch in their ear, you know you probably have had a BVD problem. This is a PI that we purchased from a farm that became kind of our positive control for diagnostic tests at our diagnostic lab. So that's why I'm not sure how our animal use care committee feels about this. But when your drug rep says it can't be BVD because you used our vaccine. So with all deference to the folks from pharmaceutical companies here, I've heard that before. I hate to say it, but I've heard that before. When your calf barn doubles as a Halloween house of horrors, and this is all too true. In fact, that dairy farm in Ohio that we worked with once with Kenny Brock, they had the worst looking calves in their calf barns, just sickly looking, poor looking when we showed up there, and turns out about 25% of them were PIs. They had a major issue with a PI problem. When you think BVD stands for bad veterinary disease, and myself included, so often when you're having health problems in general and you think your veterinarian isn't dealing with the health problems and the producer thinks that it's because the veterinarian is the problem, it may be that it's actually BVD. When you thought about your breeding program and the presidential election are one and the same, so this is one that's kind of contemporary to today. You know, breeding programs and presidential elections, I'm not sure, but they certainly make my hair stand up on end. When your nutritionist blames poor health on the previous nutritionist, you blame it on his predecessor, again, in deference to our nutritionists here, it's interesting how often nutritional things get blamed, people keep blaming nutritionists for their problems, and then when you start really digging into it, you can actually find an infectious disease problem underlying the issue. When you have cattle on your farm named Runt and Pipsqueak and Shorty and Wobbles and Tiny and Klutzo and Nubby, then you probably got a PI problem. When you just won that $1 million lawsuit against the electric company because of stray voltage, but herd health still stinks, you might have a BD problem. This actually happened in Michigan. It's actually happened in a farm in Michigan where the folks got and this was several years ago when stray voltage was the hot topic in dairy farms. Folks got a settlement, and problem didn't go away. And then when we came in and actually started doing some investigating, we found BVD virus in the farm. Actually cleaned the BVD problem up, and some of their problems went away. But they had that lawsuit, or they had that settlement from the electric company, so I guess it was all good. And then you've lost everything but your BVD. So